There are hundreds of millions of people living in the world today in extreme poverty. But there's something we can do about that. My name's Dr. Nick Ellis, and I help lead the organization MEDLIFE. MEDLIFE works hand in hand with low-income communities, empowering them in their fight for equal access to healthcare, education, and a safe home. Our vision is a world free from the constraints of poverty, medicine, education, and development for low-income families everywhere. When I started MEDLIFE in 2004, a lot of volunteering organizations were doing medical missions or things that we may consider volunteerism at the time. And I wasn't really impressed, unfortunately, with some of the services and some of the patients and what they received. Sometimes people would just hand out medications, but then 5 days later they were gone. Part of the idea was, could we do something better with the resources that people brought when they were volunteering? When we first started, we met a boy named Darwin. We had to take a bus, a truck, and hike into a village to meet him. What we found there was he had a severe heart murmur, and the doctor that was working with us at the time suspected that he needed heart surgery. We didn't even know if it was possible to get heart surgery in Ecuador at that time. Part of our model that we created was the mobile clinic model. Rather than working with doctors from the United States or Canada, we always made sure that we would partner with local doctors on the ground, doctors that spoke the local language, understand the local culture, understood the referral systems that existed in each country where we work. We combined those local physicians with local nurses that would follow up patients. When we made a difficult diagnosis, our field nurses would go back to people's homes and work with the local systems, building up those systems and bridging gaps. When we took Darwin to see a pediatric cardiologist, we learned that it was possible to get him heart surgery in Ecuador. There were gaps within the system, but the Ecuadorian government did provide those resources. We went home, we fundraised as students, and we brought back the resources that we needed to help bridge that gap, and we were able to get Darwin surgery. And after we got heart surgery for Darwin, his uncle had one more request for us. He said, "Please don't forget us." And we thought, how could we ever forget you? And he clarified, and he said, "Not just my family, poor people everywhere." And that's why we started the MEDLIFE movement. In those early days in Ecuador, we started to understand the scope of the problem. Literally hundreds of millions of families living in extreme poverty. We understood that one small student group or one nonprofit wasn't going to be enough. We had to make this into a movement. We called on passionate university students to join us on our service learning trips and understand the root causes of extreme poverty. We asked our students to take their service even farther and share the stories that they had seen on their service learning trips with their friends and family to help grow the MEDLIFE movement. And our movement grew because people like you took action, carrying the things that they learned while working with MEDLIFE into their professional lives.
Part of the principles of MEDLIFE is working hand in hand together between communities. So, a community from MEDLIFE works together with a community in Tanzania or Peru or Ecuador, and it's a partnership.
We have a chance to go to other places and help people out where they will never have that kind of help in their entire lifetimes.
I've done 3 MEDLIFE trips because of the genuine care that the MEDLIFE community has for their patients.
Now we have attended hundreds of thousands of patients, completed hundreds of projects, and helped thousands through our educational workshops around the world. And still, we can do more.
Join our movement in whatever way you can.
Start a chapter or society at your school.
Organize a service learning trip or a field course.
Fundraise for or donate to MEDLIFE.
Y compartiendo nuestra historia.
Together, we can create a world free from the constraints of poverty. A world where hundreds of millions of people living in extreme poverty is no longer a statistic, but a success story of families, communities, and a movement that came together to create change. Regardless of what you study, if it's medicine, education, law, history, anything, we need your help. Join our movement.